Hi, I'm back with another episode of Autism Awareness. This is topic 2, behaviors I do, and I'm gonna explain the behaviors that I do and it can relate to autism and why I do what I do and to explain to be accepting and patient of us even when we do different things because we can't help it. So here I go to the list. Number 1 is circuit breakers. I love circuit breakers. I love to reset them when they trip. But a behavior of mine is if they don't trip on accident, I start to get anxious because my favorite way is to have it trip just naturally and then I can go down and turn it on, but that doesn't happen very often, so I get anxious for some reason and then I gotta purposely trip one. Do you see those heaters back there? That's what I use to trip the breaker in here on purpose, and I know that sounds a little weird and I be careful when I'm doing it, so no worries, and I have permission to do it because my family understands why I need to do that. So that's a thing that I do because I need to reset a breaker. It just makes me feel better. And I get upset if I can't reset one, and then for some reason I get jealous when other people get to do it because it doesn't happen very often and I don't want to lose my chance. And I used to do it all the time, but it's been a while ago and I just feel the need to keep doing it because of my autism, and I just need people to be patient with me if I get anxious about it, or to let me turn it on if it trips because I don't get many chances. Like the last time one tripped on accident here was January 19th of 2021 and it's 2022 already in May. So I've been waiting a while for the next accident, so see why I would get anxious? So that covers number 1 about breakers. Oh, and I have my own breaker boxes too, and I fiddle around with those and I do cool things with those, like making them trip breakers with the help of friends and family and hooking up lights to it with the help of family and batteries and things like that to make nice things happen. So I think, and I like to see wires in breaker boxes. Like at my mom's and dad's old houses, I kept begging them to see the wires. Too bad I didn't get to do it at mom's old house because no one would take the cover off for me, and now I understand that because it is dangerous and we need to be careful to not touch the wires. So I kind of understand why they didn't do it. But it would have been nice if I could have seen the wires. And then I also like to see the wires at my dad's old house as well in the breaker box. And the light that shined off the side of the breaker is another thing that I really liked to see. So that's another thing I like, although sometimes my parents would be impatient with me and get frustrated with me. I don't know why, but they gotta be patient with someone like me because they should know how I am about these things. And I understand they might fear for my safety, but I'm a smart girl, so I know how to be careful. And as long as they tell me where the dangers are, then I'll try to avoid them. So that pretty much covers it for breaker boxes. So on to topic 2. 2 is farts, and I know it sounds a little bit weird, but for some reason I am obsessed with farts and passing gas because I think it's funny. I don't know why. I think it's funny because of the sound, and the whole thing about farting is just funny, and I even pass gas on purpose. Like I push it out, I lift my butt, I stick my butt out, force a toot out. I know it sounds a little weird, but and then I talk about it all the time and just make up silly things. Like I have a crazy random imagination, like farting on a tire, I say, or a jiggly wiggly fart, or just stuff that doesn't even make any sense. Or also farting on a leather seat and then smelling it. And I don't know why I used to do all those things. It's just weird. And I just need people to be patient with me when I choose to do my behaviors of farting. So it's just an autism thing, so it's like an obsession, so I can't really help it. I just enjoy it because it makes me happy, and farting is good though. We pass gas for a reason, so it's not like it's a bad thing. I know it stinks and it smells bad, and sometimes the sound of it sounds really juicy and nasty. But it's still overall funny, even if there's those two nasty things about it, it still can be funny. So I think, and I make songs about farts as well, and like I do art about farts and just any creativity. So, and I fart on tires and leather seats and like other things like gymnastics mats or just I talk about it all the time. So yeah, that's my behavior about farts. I don't need to make this longer than it needs to be. So on to topic 3. Topic 3 is going to be my tics, vocal tics and non-vocal tics. So I say joking as a vocal tic. I also get excited and blurt out either escalator, basements, circuit breaker, auto-tune, the heights, and things like that. And farts and poop, because I get excited. So, I get excited and say those. It's an autism thing. Get excited and say that. Say those words. So, I can't help it. It's just how I am. And then my non-vocal tics would probably be this. And when I was doing this earlier in the video, and when I do this with my head, and just things like that. And like this would be my tics, the non-vocal tics. What other ones would I have? Or are those about it? I can't remember. Oh, this thing is a tic that I do with my nose because I talked to my doctor about it last time we were there, and it seems like I can't stop doing it. I don't know if it's allergies or if it's a non-vocal tic. I don't know what it is. Maybe it's both. But I don't know why I do it, and I'm sorry if it sounds like I'm blowing my nose in my hands, but that's not what I'm actually doing, because seriously, I don't want to put snot in my hands. That's nasty, and I use a Kleenex when I need to blow my nose. So it's just a sound that everyone's hearing if they hear that, and I know it sounds bad, but I'm sorry. Sometimes us autistics make different noises that you might not like, and it's just something you're gonna have to deal with. Like, we can't help it. There's probably someone else out there that might make a sound that you could interpret as annoying, but it's something that we can't stop doing. And I know my sound that I do with my nose sounds like blowing my nose in my hands, but be real, guys. Am I really going to do that? No. Why would I want to blow my nose in my hands? I have tissue. We get tissue at the store. Now, come on now. So, when you hear me do that, just know that there is not snot going in my hands. If I need to blow my nose, I will use a tissue. So no need to worry about that. So I think this pretty much covers it for my tics, vocal tics and non-vocal tics. I think I pretty much nailed all of them. So on the topic, topic 4 is gonna be sensory things. So 1, I play with tape. I play with Scotch tape. I like the green Scotch tape with the wide version, not the skinny version. I like to play the stickiness and like fidget with things. I have like a bubble pop thing. I'm sure we've seen those in fidget spinners and things like that. And I also think loud noises. I can't do really loud noises, otherwise I start to get overwhelmed or anxious or something. I was anxious the other day and I got overwhelmed in the big crowd because I guess I just needed to be where I was comfortable. Hopefully no one noticed me, because that would be embarrassing, and I don't want to give people the wrong message about myself, all because I was overwhelmed in the crowd when I was anxious. But I hope everything is fine. And when I touch a spider web, I freak out. I don't like spider webs. I also think fire alarms are too loud, so I want to try not to be where they set them off to test them. And mayonnaise is disgusting. I gag at things easily, like mayonnaise and sour cream and whipped cream and things like that. I just gag at those. I don't mean to be whatever, but it's just how I am. It's a sensory thing. So, what other sensory things do I have? I can't remember. Well, I like to listen to music all the time, 'cause it's like comforting and calming for me. So there's not a time where I would want to turn off music just to turn it off. Like, I need to be listening to it all the time because it just makes me feel good. It makes me feel good. So I think I pretty much covered all the sensory things, the main ones for me, just to get the idea of what happens with us. So if we start to get overwhelmed or start to get uncomfortable, just comfort us and don't be hard on us about it. And if we keep doing something like playing with tape, I know my tape gets everywhere, family and friends, but I don't mean to just peacefully get it. I try to get it when I drop it. Sometimes I lose it, and I don't mean to leave it there, because sometimes I drop my tape and forget where it went, and I try to find it and I can't find it, and it's just frustrating. So please don't be stern on me about that. It's not like I'm just throwing my tape everywhere just to do it. When I'm done with my tape, I put it in my purse. So then now I have a big mess in my purse to clean up, and I'll have to take it all the used tape out and throw it in the trash. So I'm not trying to make a mess with it, and I'm sorry if it gets on your clothes or things like that, but that's just the consequence of having a family member or a friend with autism, because I have to play with tape. I can't give it up. I try not to get it everywhere. I try to be careful, but sometimes I just have days and I just drop things, and just be patient with me. It's not the end of the world. We can get the tape out, because I try to pick it up. I try to find it. It's just sometimes I can't find it. So if you find it, just it's fine. Just pick it up, throw it away for me, and it's not the end of the world. So I think that covers it for sensory issues and things that I need. So on to 5. Okay, last one, I just looked, and when I got to go look, then I remembered, oh, it was poor hygiene, because sometimes it's hard for me to keep up with my hygiene. Like, I brush my teeth once a day, and they encourage me to do it twice a day, but I just can't get to twice a day. And sometimes I am not very good on showers or baths. Sometimes, like, they encourage us to do it like every day or every other day, like on point, but sometimes I wait a little longer if I'm feeling tired and need to rest. But I do end up getting in, because I don't like to smell funny. I don't like to feel nasty. I like to be clean. I like to smell good, so I try to get in when I can. So at least I'm doing a few in a week instead of once, like I was when I was depressed a couple years ago. So I'm trying my best, and I try my best with deodorant, and I also lack shaving. That's something that I really need to work on. And so I need to try to get motivation more to shave my legs and armpits. So I don't want to go more into detail, because that's a personal thing, but I'm just giving the idea that sometimes I kind of lack taking full care of myself. Like, if I get tired and just want to lay and rest and stuff, because I just feel like things make me tired. Maybe it's my autism that makes me tired. I've always been a sleeper since I was a kid. Like, ever since I was a kid, I would be laying in my room in the middle of the day, just laying down, just to lay down and rest, because I wouldn't feel like doing anything. So it's not new. So, and plus I'm not a morning person, so it's really, really hard to get me up in the morning. So that's another thing. So I think that wraps it up for today's video. So I hope you learned something, and remember, with the behaviors that I do or that anyone else does, be patient with us about it. We can't help it. It's from our disability. So please be patient and don't criticize us, and just be lucky that we're here. Be lucky that God created us the way we are, and we do different things. So, end the video.